Hi everybody, Dr. Scott Keller with Synergy Chiropractic Spine and Joint Center. Today I want to talk to you about the squat and how arguably the squat and just being able to squat in this type of position is one of the most important functional movements that we as human beings can obtain. And honestly, if you have kids or grandkids or just watch any young kid from the time that they're a toddler until they're 8, 9, 10 years old, they can really squat absolutely flawlessly and perfectly. What you see is they're able to sit down in this position and rest in this position. They play in this position. Their ankles and their knees and their hips and their core and their spine are all in really awesome positions. Now, as we all get older, we sit in desks or we start working, we have injuries. There's a plethora of things that can cause us to lose the ability to obtain a good squat. Now, not everybody's ever always going to be able to get that low, nor am I saying you have to. But if you just think about on a daily basis, we see patients obviously all the time with lower back pain, hip pain, knee pain, up and down the chain. And so many of those issues come from repetitive motion injuries or repetitive stresses such as bending over. So, in the last few years for me personally, when I started having kids, having babies and putting them on and off the toilet and getting them in and out of the crib and just bending over to play with them or picking them up off the ground, I just started noticing, it's really hard on your lower back to bend over like this, especially when you're trying to lift things. But even more so than that, just daily household things like putting the dishes in the dishwasher, doing laundry out of the laundry basket, bending over to get in the dryer. I just got in a really bad habit of just doing this kind of thing all the time. It puts a lot of stress on your lower back. So we need to be able to squat, to use our hips and to stabilize in our core. Even when I'm doing the dishes, for example, I'm usually squatting to put dishes in and out of the dishwasher like this, or to pick something up off the floor. I can't stress enough how important that is. So here's a couple of tidbits for you to work on. And to just think about. Over the next few weeks, Dr. Tyler, Dr. Tracy, and I are going to be giving you a lot of good research, but also some examples of things that you can do to help yourself obtain the squat position. If you can't stand with your hips about feet width apart, and everybody's a little different, a little wider, a little narrower, a little foot flare, no foot flare, just kind of find what feels comfortable for you. If you can't go down like this and keep your chest upright and you kind of get that butt towards the floor with somewhat of a parallel from your leg to your spine like this, then you probably need some work. Now again, it can be a lot of things that limit the ability to go down there. It could be flexibility in your ankles, it could be flexibility in your knees and your hips, and it could also be a lack of strength or stability in your core. Some of those details we're going to get to later, but I want to show you a really simple way to start working on getting into that squat position that can just help you achieve that range of motion. So here I have this upright, which is nice to have, but at home you could use a countertop, a door handle, doorknob, a banister, anything that's solid and is not going to move. All I'm going to do is grab around it about waist or belly button height, and then I'm just going to slowly start sitting backwards and going down until I feel comfortable. Now, if you can go all the way down like this, that's great. If you have to stay up here, that's completely fine. But what we're trying to do is get as low as we can. You're really working on the range of motion through your hips and your knees, but also making sure we're staying tight and stable through our core. So you don't want to arch your back this way, and you don't want to necessarily flex your back a lot this way. So staying nice and neutral as you descend. Now, a lot of people, if you can get to this position, if I would have you let go, you're going to fall backwards because you don't have that balance and coordination and or range of motion yet. So this is something that we do give a lot of patients of ours in the office just to work on. It's called a supported functional squat. So just hold on to something, get down in the whatever range you feel comfortable, and just hold, work on breathing through your belly, work on relaxing and obtaining that position, okay? So as you hold that for different intervals, and you do that longer, you probably will notice you're building strength in your legs, and also the ability to do that will increase. So hopefully that'll give you a little bit of warm-up for some things yet to come in future weeks. So please stay tuned. We have more details to come. Dr. Scott with Synergy.